Hello and welcome to Module 2, the Living Kidney Donor Evaluation Process. This module will discuss various aspects of becoming a living kidney donor. The Living Kidney Donation Team is a group of highly skilled health professionals who work together to help the potential living kidney donors through the evaluation process and donation. Before being approved as a living kidney donor, the Living Kidney Donation Team will evaluate your physical and mental health. The evaluation process will require several tests, such as blood and urine testing, X-rays, CT scans, and consultations with various members of the team. The members of the Living Kidney Donation Team include a clinical coordinator. The clinical coordinator, also called a Living Donor Assessment Coordinator, is a registered nurse, RN, who guides potential living kidney donors through the evaluation process and provides teaching and support throughout. An administrative assistant. The administrative assistant schedules your tests and appointments and will assist you with changes or cancellations. They can also provide valuable information about the evaluation process. A social worker. The social worker meets with all potential living kidney donors. They will discuss your decision to donate a kidney, your understanding of living kidney donation, and its possible impact on you, your family, and the recipient. They will work with you and your support persons to plan for donation, keeping your unique needs in mind. They will offer supportive counseling for you and your family to talk about the emotions you may have related to living kidney donation. Your social worker will also be able to advise you about employment and financial issues. The social worker will also discuss with you the program for reimbursing living organ donors, PRELOD, which is operated by the Trillium Gift of Life Network. This program will reimburse living kidney donors for their expenses. For example, with PRELOD, living kidney donors can receive reimbursement for the following items: travel expenses incurred, parking and/or transit, accommodation, meals, and loss of income subsidy after surgery. Of note, claims made for follow-up assessments after surgery are eligible for reimbursement for 1 year after surgery. Reimbursement for companion expenses, for example travel, accommodation, and meals, is also available during the surgery and recovery period. Only expenses that meet specified eligibility criteria will be considered. PRELOD is a program which aims to reduce the financial burden associated with the living kidney donation process. Expenses such as prescriptions, entertainment, telephone, and expenses incurred by primary caregivers and visitors and/or family are not reimbursed through PRELOD at this time. You will receive detailed information about PRELOD during your evaluation, and contact information for PRELOD will also be provided to you. A psychiatrist. The psychiatrist may see you, depending on your needs, during the evaluation process. These professionals specialize in mental health and will address these issues as they relate to living kidney donation. A nurse practitioner. The nurse practitioner, NP, is a registered nurse who has met additional education, experience, and exam requirements set by the College of Nurses of Ontario. The NP is authorized to diagnose, order, and interpret diagnostic tests, and prescribe medication and other treatments. The NP works in collaboration with the donor nephrologist to determine if it is safe for you to donate your kidney. You may meet the NP prior to donation and after donation to evaluate your overall health. A nephrologist. The nephrologist is a doctor who specializes in the diagnosis and treatment of kidney disease. The nephrologist will determine if it is safe for you to donate your kidney. The nephrologist will also discuss the short and long-term risks of living kidney donation with you and may discuss lifestyle changes or treatment which can decrease your risks. 3 and 6 months after the surgery, you will meet with the nephrologist again to make sure your remaining kidney is working well. A surgeon. The surgeon may be either a urologist or general surgeon who specializes in living kidney donation and kidney transplantation. They are responsible for performing the kidney donation and transplant surgery. You will be seen by the transplant surgeon once you have been cleared to donate by the nephrologist and your surgery has been scheduled. This appointment usually takes place about 1 week before your surgery. During this appointment, you and your surgeon will talk about donation surgery as well as the risks of surgery. An anesthesiologist. The anesthesiologist is a doctor who will assess the safety of giving you anesthetic, medication that puts you to sleep, during the donation surgery. The anesthesiologist is also a member of the pain management team. They can help you select which form of pain management will be best for you after your surgery. This appointment also takes place about 1 week before your surgery, once your surgery is scheduled. Separate teams assess transplant recipients and potential living kidney donors. This is to ensure that there is no conflict of interest involved in your evaluation as a potential living kidney donor. In order to donate a kidney, you must be assessed to find out if you are suitable to donate. This assessment requires a number of tests, including blood and urine samples, X-rays, CT scans, and consultations with various members of the living kidney donation team. The living kidney donation team will also want to ensure that you have thought about all the aspects of donating a kidney and have been given the opportunity to have your questions answered by the most appropriate team member. If you, as a potential living kidney donor, are found to have a health problem, you will be directed to either your family physician for follow-up or to a specialist. The living kidney donation team is here to support you and act in your best interest. All health information about you, including your test results, is strictly confidential and will not be discussed with your potential recipient. It is important to note that there are many possible outcomes of this evaluation process which may occur at any stage of the evaluation. You may be found suitable to proceed with living kidney donation or deemed unsuitable to proceed with living kidney donation. In the event that you are deemed unsuitable to donate, you will be provided with a detailed explanation. The evaluation process typically takes around 3 months. However, based on your individual circumstances, additional testing may be required, which may prolong the evaluation process. The first step towards becoming a living kidney donor consists of completing a health history questionnaire. This questionnaire is available on our website or from a member of the living kidney donation team. This questionnaire includes general information about your past and current health and why you are pursuing living kidney donation. The living kidney donation team will review your questionnaire carefully to determine if you are suitable to proceed with evaluation. There are certain conditions that may prevent you from donating. For your safety and the safety of your intended recipient, it is essential that you complete this form truthfully. If there are no issues that prevent you from proceeding with evaluation, based on your health history questionnaire, you will be informed that you can begin your evaluation. Typically, your evaluation begins only once your intended recipient has been referred to our transplant program. The living kidney donor evaluation process at Toronto General Hospital is divided into 3 phases. Phase 1 of testing includes blood and urine tests as well as an EKG. These tests are important to checking your overall health and the health and functioning of your kidneys. These tests will also determine your blood group in order to determine if your blood group is compatible with your intended recipient. These tests can be completed at your local lab, for example, Life Labs, or at Toronto General Hospital based on your preference. The results of your Phase 1 tests will be reviewed, and should you be deemed suitable to proceed with evaluation, you will be asked to complete Phase 2 of the evaluation. Phase 2 of the evaluation process takes place at Toronto General Hospital or affiliated clinics and involves medical imaging and appointments. During Phase 2, you will be asked to complete an X-ray of your chest and a CT scan of your abdomen. These tests look for any internal abnormalities that may affect your health or the health of your kidneys. You will also meet with a social worker to discuss your decision to donate. A support person can join you for this assessment as long as they are not the recipient. The support person will be asked to leave at a certain point so that the social worker can have private discussions with you. During the social work appointment, the following may be discussed: how you decided to donate a kidney, your understanding of living kidney donation, as well as the possible impacts of donation on you, your family, and the potential recipient. How your social worker can work with you and your support persons to plan for the living kidney donation while keeping your unique needs in mind. Employment, financial, and practical aspects of living kidney donation. How your social worker can provide supportive counseling, if needed, to you and your family before and after living kidney donation. Depending on your unique circumstances discussed during your appointment with the social worker, you may also be scheduled to see a psychiatrist as part of the evaluation process. During Phase 2, you will also meet with the clinical coordinator for an education session. During this education session, your clinical coordinator will discuss all aspects of living kidney donation, from the evaluation process to the donation itself, including preparations for donation and instructions after the donation surgery. Special circumstances that pertain to you and your intended recipient, such as not being the same blood group, for example, will also be discussed during this education session. You will also have an opportunity to ask any questions you may have. Your clinical coordinator will also review what cancer screening tests you will need to complete should you be suitable to donate. All donors over 50 will need to complete colon cancer screening within 2 years prior to donation. Women will require a pap smear completed within 3 years prior to donation, and women over 50 will require a mammogram to be completed within 2 years of donation. These requirements are the same as the general population and should be completed by your family doctor. In addition, some potential donors will be asked to complete a tuberculosis skin test. During this phase, you will also complete special testing called HLA typing and a cross-match. This is a different test than the blood group test. This testing will determine the degree of tissue compatibility of your kidney with your intended recipient. If you are not compatible with your intended recipient, there are still options for you to donate your kidney to help your intended recipient. This is covered in more detail in Module 3, the Kidney Paired Donation Program. Finally, as part of Phase 2, potential living kidney donors that are above 50 years of age for men and 60 years of age for women will also be asked to complete a stress test of the heart. Depending on the results of your investigations and your medical history, you may be asked to complete additional tests and/or consultations. Once the Phase 2 testing is complete and acceptable, you will move on to Phase 3 and attend an appointment with a donor nephrologist. The nephrologist will meet with you to review your health history, complete a physical examination, and discuss your test results. The nephrologist will determine whether you are suitable to donate or whether additional testing is needed. The purpose of the appointment will be to make sure that it is safe for you to donate a kidney. and to ensure that you are aware of the benefits and risks of living kidney donation. Should you be deemed suitable to donate, you will be able to proceed with kidney donation. If you are compatible with your transplant recipient, and your transplant recipient has been cleared to proceed with kidney transplant, your surgery date will be booked. You will be scheduled for a series of preoperative appointments with the clinical coordinator, the surgeon, and the anesthesiologist, as well as to update your lab tests. This is discussed in further detail in Module 4, Living Kidney Donation Surgery. If you are not compatible with your transplant recipient, options will be discussed with you, such as enrollment in the Kidney Paired Donation Program. If you miss a required appointment, you will be contacted by the administrative assistant to rebook. Please inform the administrative assistant as soon as you are able if you need to reschedule or cancel. If you miss the same test or appointment on more than 3 occasions without notification, the Living Kidney Donation team will assume that you do not wish to continue with the living kidney donor evaluation. You will be notified of this, and you will be required to contact the Living Kidney Donation team within 2 weeks. If we do not hear from you, we will stop the evaluation process. The potential recipient will be told that you are not a suitable candidate for living kidney donation at this time. As a potential living kidney donor, you will be treated by a completely different team of healthcare professionals than your intended recipient. None of your health information will be shared with the recipient. Similarly, the living kidney donation team will be unable to provide you with information regarding the health of your intended recipient. Potential living kidney donors and recipients may share as much or as little information with each other as they wish. As a potential living kidney donor, this is up to you based on your personal preferences. Choosing to donate one of your kidneys is a big decision which must be voluntary. You may also wish to think about how living kidney donation aligns with your beliefs, morals, and values. You should not donate if you do not want to, and you should not feel pressured by others to donate. If you decide that donating is not the right choice for you at this time, the Living Kidney Donation team will be available to help you deal with this. It is important that you take the time to think about your decision carefully. You may end the donor evaluation process at any time, and the specific reason for ending your workup will be kept confidential. The intended recipient will not be told the reason that you do not wish to donate. Rather, the recipient will be informed that you are unsuitable for living kidney donation. You may wish to tell your intended recipient yourself, or you may ask your clinical coordinator to assist you if you wish. If multiple living kidney donors are interested in donating to the same recipient, the Living Kidney Donation team will review the living kidney donor health history questionnaires and determine the most suitable individual to begin the evaluation. Only one potential donor is evaluated at a time for a transplant recipient. The other individuals will then be considered backup living kidney donors should the initial living kidney donor be determined medical unsuitable during the evaluation, and may be contacted later if the initial living kidney donor cannot proceed with living kidney donation. You have now completed Module 2, the Living Kidney Donor Evaluation Process. In this module, we reviewed the Living Kidney Donation team, the living kidney donor evaluation process, communication between donor and recipient teams, and things to consider when choosing to become a living kidney donor. In the next module, we will review the Kidney Paired Donation Program.